We begin this hour with that breaking news.
The coronavirus death toll rising. More than 12,000 cases confirmed worldwide.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
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 Coronavirus. 冠状病毒.
The novel coronavirus. What is it? Who are more vulnerable to it? What can you do to prevent yourself and others from the virus? Let's find out. I'm 𝗟, and normally I do a lot of tech reviews on this channel, but due to the urgency of this world health crisis situation, I decided to do this video as I feel this has to be done to increase the awareness among people. So what is the 2019 novel coronavirus? Well, the 2019 novel coronavirus is a new respiratory virus which was first identified in the city of Wuhan of Hubei province in China. This virus is spreading among people at an alarming rate due to its capability of human-to-human transmission through direct contact with case patients by respiratory droplets and contaminated objects and surfaces. For an instance, if you have the virus inside your body, unlike the cases of Ebola and SARS, this novel coronavirus has the potential to infect another person even before you show any symptoms. That is basically during its incubation period of 1 to 14 days after the virus enters your body. So who are more vulnerable to this new coronavirus? Generally speaking, everyone. Even if you are a very healthy individual with an excellent immune system, if you are exposed to a large number of viruses at once, then you are prone to get sick. Thus, infection depends largely on exposure. But people with poor immune system are more vulnerable and the disease progresses faster and is more severe. So basically, the elderly, pregnant women, children, people with chronic diseases are more vulnerable to this novel coronavirus. So what are the basic preventive measures and how can you protect you and others from this virus? Number 1. Hand hygiene. According to many health professionals, keeping your hands clean is the best and the most recommended way to prevent yourself from possible infections, because it is estimated that a person touches the face 23 times per hour, by which the virus can find its way directly into your body via your nose, eyes and mouth. Wash your hands frequently with soap and water for at least 20 seconds. Make sure to clean the area between the fingers as well. If soap and water are not available, use an alcohol-based hand sanitizer which is having an alcohol percentage of about 75%. Number 2. Wear a mask. Masks in general can prevent airborne particles entering your body. Any mask is better than no mask at all. However, for this virus, surgical masks and N95 masks are the most recommended. Surgical masks are quite easy to find and the prices are affordable as well. They will help protect you by preventing exposure to large particles in the air that may contain viruses. At the same time, it also prevents you from other people's body fluids released when sneezing or coughing. On the other hand, N95 mask has the capability of filtering 95% of the particles by blocking large particles as well as small particles in the air. Thus, experts believe that N95 masks are more effective in prevention of coronavirus. However, surgical masks are still good enough in the prevention of coronavirus infection. And there is only one way to wear a surgical mask correctly, and that is with the colored side facing outside. It doesn't matter if you want to wear it because you are sick and don't want to spread your germs, or you want to prevent yourself from being infected. The colored outer layer is a waterproof layer while the inner white layer is there to absorb moisture, as the air we breathe out contains moisture. Most importantly, there is also a middle layer that filters pathogens. The function of the colored layer is to prevent germs from sticking onto it. If you wear the mask inside out, the moisture from the air will stick onto it, making it easier for germs to stay there. So when you breathe in, the germs will later transfer from the outside into your lungs. Make sure that the mask fully covers both your mouth and nose. When you wear it, first place the wire mesh onto your nose and tighten around it. Then wrap the straps around your ears and drag the mask down your chin to cover the mouth properly. The mask should be replaced with a new one after several hours of usage, and make sure you sanitize your hands afterwards. Number 3. Clean and disinfect frequently used objects and surfaces. Disinfectants can be used to sterilize surfaces like chairs, beds, floors and tables. Bleaching agents also can be used to kill pathogens. Sunlight is a direct and natural UV sterilization remedy which can be used for clothes, toys, beddings and etc. Boiling water at 100 degrees Celsius can be used for sterilizing small items such as cutlery, certain toys, baby bottles and etc. Number 4. Improve your day-to-day habits. Try to reduce touching the face, especially on the eyes, nose, mouth with unwashed hands. Cover your mouth and nose with a tissue when coughing or sneezing and throw the tissue into a closed bin after use. Avoid unprotected contact with sick people, including touching one's eyes, nose or mouth. Maintaining indoor air quality by having enough ventilation is very important as well. Avoid close contact with live or dead farm or wild animals. Number 5. Improve food safety practices. Meat, eggs and vegetables should be thoroughly cooked before consumption. Try to use separate cutting boards for raw meat and fresh vegetables. Number 6. Improve your body's immunity. How can you do that? Start having healthy balanced diet by consuming food that contain antioxidants. Also, get enough rest. This is very important as this habit will make the body's immunity system more protective against viral infections. In fact, a doctor in China who was infected by this novel coronavirus after visiting Wuhan was reported to have been recovered by getting ample rest. Other general habits like drinking more water and exercising regularly can boost up your immunity as well. What are the symptoms of this virus? Some common signs of infection include runny nose, headaches, cough, sore throat, fever, and shortness of breath, and in some rare cases even vomiting and diarrhea also. What to do if you have these symptoms? If you have some or all of the above mentioned symptoms, seek medical care right away. Lab testing is needed to confirm if a patient is infected with this virus. So if you follow these hygienic practices thoroughly, medical professionals are adamant that you can be safe from this novel coronavirus. At the same time, you can help prevent the spread of this deadly disease as well.